In the category of promoting better health and avoiding disease, the judges were looking for entries with a clear strategy and outcomes that would improve the health and well-being of the people in Wales. Nutrition Skills for Life is a project that's about training people based in the community on good nutrition. It's delivered by community workers, but the project itself is developed, it's a quality assured project developed by regulated dietitians within the NHS in Wales. It's a project that covers the whole of Wales, and what is learnt in one area of Wales is shared very openly with other parts of Wales, and I think that's something that the judges really admired about the project. And the thing about nutrition skills is it's not just about health, it actually begins to tackle those wider agendas around poverty, building strong communities. And by using community workers, the project was able to reach out to people that quite often as professionals we have difficulty securing. There's clear evidence that the outcomes of surgery can be affected by factors such as obesity and smoking, what we call lifestyle risk factors. And in Cardiff and the Vale, they've worked together right across a number of disciplines to start the process that actually supports patients in changing those behaviours in plenty of time before they are going into elective surgery. So individuals are offered and are expected to accept support in these areas. The judges were very impressed by the commitment to the team, from the team, across a whole range of disciplines, and also involvement of other agencies outside of the NHS to actually support patients in making those positive choices, which in reality then could have a real impact on the outcome of their surgery. This innovative project was led by a support worker in Cardiff Prison. Prisoners were encouraged to participate in drama in order to explore some of the issues that they were dealing with in their own lives, in their lives in prison and in their life before prison, in order that they could work through some personal issues and some mental health issues. The panel were very struck by the level of commitment from both the prisoners but also the staff involved, right up to governor level. It was a challenging environment in which they had to work. The prisoners themselves turned up for every session that they were expected to, and in fact wanted more opportunity to participate, which resulted in a good sense of teamwork within a difficult situation, but it made a real difference to the people that we talked to. The judges were very impressed by the level of perseverance and commitment that all of the people involved in these projects demonstrated. It was a real pleasure to work in the NHS and to see that colleagues have such a positive approach to the work that they do. We recognise the importance of trust in the people that you're working with, but also trust in the people that you're working for. The value of actually involving people in their own health is clearly evident through all of these projects.